Welcome to the Ask the Experts show with local celebrity hosts Steve-O and Renee. Sit back each week while Steve-O and Renee educate you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O and Renee with today's expert in their field.
Hey, good afternoon and welcome to another Ask the Experts, where we bring you the top experts in their field, in fields of health, legal, financial, and home improvement. And you can catch our show every Monday or Friday from 4 to 5. Today's show is very dear to my heart.
It hits home for you.
Yeah, kind of for you.
Me too.
Yeah.
It affects me too.
Absolutely. We're doing a show on sleep disorders today, and let me introduce you to the woman with the great laugh, my co-host forever, Renee.
What's happening?
How you doing? This is a cool show for me to do today.
For me too.
Yeah.
I may get some answers.
Oh, that's right. And if you'd like to watch today's show right now, if you'd like to watch us live, go to www.sultan, that's SULTAN, surgicalcenter.com. You go to the page and there's our show. We're live, living color. And so let's get started by introducing to you to Dr. Leslie Sultan.
Welcome to the show, Dr. Sultan.
Thanks for inviting me.
Well, we definitely found the creme de la creme, as we always say, and not just in sleep disorders, sleep apnea, but also in dental implants, and we're going to go over some of his other services. Today we're going to talk about sleep apnea, which I have.
Yes, you do.
And I wish there was a pill for it. But anyway.
One day there may be.
Yeah. So
there is a pill, Dr. Sultan.
Tell us about your practice.
Sure. Just to give you a brief bio, I am originally from New York City. In a former life, I was an organic chemist before I decided to go to dental school. To make a long story short, I started out as a general dentist, decided that my calling was more in surgery.
You got bored with that, admit it. Come on.
I like the challenge. I enjoy the challenge. So I challenged myself by doing a surgical internship at University of Miami, oral and maxillofacial surgery residency at Mount Sinai Medical Center in New York City. Over the past 26 years, I've had the opportunity to work with international surgeons in a lot of areas in my field. At this point in my career, I have developed more of a boutique-like practice, which I think you're allowed to do after 26 years.
Yes.
And what I've chosen to do is concentrate on the fields of interest that really enjoy me and challenge me. My emphasis is treating patients using computer-guided surgery. And the area that we're going to be talking about today is sleep disorders, which is really a three-dimensional evaluation of the airway and how we treat it.
Okay.
So how long have you been treating sleep disorders?
In the last 26 years, we started off probably back in the early 1990s. And I tend to use the phrase quite often, the hammer and nail philosophy. Back in the early 90s, there were companies that were coming out with new gadgets or toys to treat different problems. One of the first, I call it a toy, that came out was a carbon dioxide laser. And one of the first procedures that was developed for use with carbon dioxide laser was called the LAUP, which is laser-assisted uvulopalatoplasty, which was a minimally invasive office-based treatment for snoring and mild sleep apnea. And we got to the point where we did so many procedures using it, we found out what worked and what didn't work. There have been so many different variations on the same theme over the years. We've now developed procedures for surgical treatment of sleep apnea as well as basic snoring that really focus on the areas of blockage anywhere in the airway.
Okay, so why do people snore? I need the answer. Wait a second. I need the answer to that.
Okay, flip a coin. But can you have,
heads I win.
Can you snore but not have sleep apnea?
There is a corollary. Okay, not everybody that snores has sleep apnea, but everybody that has sleep apnea does snore.
Okay, that explains it.
Obviously, you have sleep apnea.
You think?
So how do you make this determination? How do you test people for sleep apnea? It's funny because years and years people are snoring and they don't realize. I mean, it's actually a health risk by not doing something about it.
That's correct. Just to go through some statistics. About 45% of the adult population occasionally snores. And out of that population, about 25% is a habitual snorer. The majority of snoring patients are men. People that have obstructive sleep apnea have to realize that it's a disease, not a condition, but it's a disease. It's a very serious disease in that it affects overall quality of life, which I'm sure the two of you know very, very, very close to your heart. It also affects cardiovascular disease. It also affects the incidence of stroke. People that have sleep apnea are 7 times more likely to have an automobile accident. They're about 5 times more likely to have a cardiovascular event as well. So it's a very important thing to diagnose and treat.
I was always tired.
And you have to be treated for this because it really could, I mean, like you're saying, it could really affect your health.
It's become a boutique disease, I would say, over the past 10 years, where in the past, we kind of brushed over it in our exams. We didn't really concentrate on it, but it's become more and more prevalent in today's society.
Okay, so
what's the difference between snoring and sleep apnea?
Be glad to explain. In order to understand what the differences are, we have to understand what the airway is. Okay, the airway basically extends from the tip of our nose all the way down to our vocal cords. When somebody breathes in air, the air goes through the nose, it goes through the nasal septum, goes through the nasal cavities. There are tissues in the nose called the turbinates, the nasal valves. As the air passes a little bit further posterior, it passes behind the soft palate where our adenoids are, goes a little bit below our tonsils and the base of tongue. A little bit below that, we have our epiglottis and our vocal cords, and that goes into the respiratory passages of the lungs. As we get older and due to certain conditions, medications, foods that we can eat, the soft tissues of the airway tend to get very lax. And as we go to sleep, most people sleep lying in the supine or flat position. What happens is that our lower jaw, also called the mandible, falls back. And as the lower jaw falls back, the tongue musculature also falls back. In a normal person, we have enough muscle tone to support the airway, but in a very lax patient, in a very lax muscle situation, the airway is not supported and it partially obstructs. So as we breathe in, due to the partial obstruction and the loose tissues, the airway tissues will vibrate. That's going to cause a snore. If it gets more severe and we get a complete collapse of the airway, and this can occur anyway along the airway that we described, that will cause symptoms of sleep apnea.
So wait, I just want to ask a question. So what are some other signs of sleep apnea aside from just snoring?
Aside from snoring, I think that the most common symptoms are, number one, excessive daytime sleeping, falling asleep during...
While you're talking to somebody?
That can happen.
Because he's done that. That's what I'm saying, Dr. Sultan.
I've seen that happen.
I thought I was just boring.
It can be very uncomfortable when a patient walks in your office and you're talking to them and they fall asleep.
Right.
You can't take it personally.
I was getting a complex.
That's right. You can't take it personally. But excessive daytime sleepiness, getting up many times throughout the night to urinate, waking up in the morning with a headache, not being able to concentrate, having problems thinking throughout the day, palpitations, chest pain.
Wow.
These are common symptoms.
How about, is loss of hair, is that anything that, no, I guess not.
Can't help you with that today.
But you're absolutely right, because I was going in culinary school and I was sitting up at the front and all of a sudden I feel someone shaking me like, wake up.
That
How
was me
embarrassing.
that was me with my elbow.
No, but I mean, in school, here I was,
Yes.
And it's embarrassing, first of all. And listen, if you feel like that you might have sleep apnea or you're
kidding aside, it's
call
serious,
us right
yes.
now at 888-565-1470 if you have a question for Dr. Sultan. That's 565-1470. While we're doing phone numbers, give everybody your phone number.
Sure. The office phone number is 771-8772.
So if your husband's snoring tonight, like 4 o'clock in the morning, give Dr. Sultan a call. No, I'm just kidding you. Now, how do you diagnose sleep apnea?
One of the easiest things to do is to take a questionnaire. Okay, and the questionnaire that we use, it's been used for years. It's a subjective questionnaire based on your symptoms, but it gives us a feel as to how likely that you may have sleep apnea. And this can be found on my website. You can Google it on the internet. It's called the Epworth Sleepiness Scale, EPWORTH. And it asks you how likely you're to fall asleep in 8 different scenarios. And the scenarios are graded on a scale of 1 to 4. And based on your numerical score at the end of answering those 8 questions, it'll give an idea as to how likely you may have sleep apnea. And anything over a 9, you're in trouble.
Wow.
So let's give them your website address. That's a great idea that you have these questions, because I had to go to a sleep center, spend the night. It'd have been much easier if I could have just answered your questions.
Unfortunately, the sleepiness scale gives an indication, but it doesn't provide a diagnosis. For example, if you were to come to me on a consultation and you had the symptoms of sleep apnea and you wanted to get worked up, we would do a number of things. And as I mentioned before, the key to treating sleep apnea is making an accurate diagnosis as to what type of sleep apnea you have. Number 2, the severity of the apnea. And number 3, where the blockages occur in the airway. Because not every patient is going to be treated the same way. For example, in the realm of sleep apnea, there are 3 basic types of apnea. The most common, and I'm assuming that may be the one that you have, is obstructive apnea, which is due to an anatomic blockage somewhere along the airway. The second most common type of apnea is central apnea, which basically the brain tells the lungs, don't breathe. And that occurs due to many central nervous system disorders.
So you literally stop breathing?
That can happen. And then there's something called mixed apnea, which is a combination. In order to get diagnosed with obstructive apnea or the other types of apnea, you really need to go for a sleep test. Another word for a sleep test is a polysomnogram. There are 2 basic types of sleep tests. There is a hospital-based sleep test or a facility-based test.
That's what I had.
And there's a home-based sleep test. The basic premise behind that is that you go into a room that's comfortable, you fall asleep, you're hooked up to a certain number of monitors that look at different body parameters, and based on your responses over a period of time, you can be diagnosed with the problem. And depending upon whether you have the home-based sleep study or the facility-based, you'll get different amount of information. Once we have the diagnosis of sleep apnea, then we go on to find out where the blockages are. And at that point, that's where my services normally come in. Because what we do is we do a complete 3-dimensional analysis of the airway. Number 1, we do a clinical exam. We take a look. We look all through the airway. Second thing that we do is we do something called a nasal fiber optic evaluation, where we take a small, thin tube, similar to somebody going in for a colonoscopy. It's something much smaller that we insert through the nose.
But you put to sleep for this procedure.
It's done under local anesthetic.
Wow.
We anesthetize very well.
Okay.
But we insert this probe, I won't call it a probe, but we insert a scope, and it goes all the way through the airway, and we see the airway as we're breathing, and we see where the collapses of the soft tissue are. The third thing that we do, which is extremely important, is we get a 3-dimensional CT scan of the airway that can look not only at the soft tissue dimensions of the airway, but also of the bony structures of the face. Because we're finding now more and more that there are certain anatomic skeletal relationships of the upper jaw and lower jaw that predispose patients to sleep apnea.
Oh, interesting. Wow.
I got to tell you something. When I went through my phase, they didn't do any of that for me. And when we sat down
Well,
for the
he has
first
the
time,
newest technology.
yes, but you know what? I think Dr. Leslie is very meticulous. He is going to find out exactly what's wrong. And I love this about you because, this is the way it should be done.
I totally agree. That's why I pride myself in doing what I do. And, I knock on wood, we try to get as good results as we can. And I'll preface, the talk by saying that when patients come into me, I never promise them results. Every patient is an individual. Everybody is going to respond different to different forms of therapy. And I always put patients in an 80-20 rule or an 80-10-10. Every 10 patients we treat, 8 out of those 10 are going to do very well, as long as they're diagnosed properly and treated appropriately. 1 out of every 10 patients is going to do okay. 1 patient may have a complication, but you stick with the surgeon, you have trust in the person that you work with, and we get you through it.
So if you're overweight, does that play a factor for sleep apnea?
The common perception of patients that have sleep apnea are patients that are overweight or obese. Not necessarily true. There is a greater subset of patients that are overweight, and we look at something called the body mass index, which is a ratio of the height to weight. And normally, if the body mass index is over the number 30, there's a good chance that they're predisposed to apnea. We look at their neck circumference. How big is the shirt that you're wearing? If your neck size is bigger than 17, your risk factor goes higher.
Right.
But there are certain skeletal jaw relationships that we see. I see many patients that come in that are thin, they can be underweight, but if you look at them, they either have a very small lower jaw with a big overbite, or they have a very flat face. And those deficiencies in the upper jaw and the lower jaw basically will cause a developing collapse of the anatomy, which will result in sleep apnea.
Wow.
So I won't say anything about my size 18 and a half. I won't say
Well,
anything.
obviously you have sleep apnea. We've already determined that.
We have, okay. Give everybody your phone number again.
Sure. 954-771-8772.
We know this for a fact that it really does play a number on your quality of life, because if one partner doesn't have sleep apnea and the other one does, whoa, it's not good. Trust me.
It's not uncommon that we have patients that come in either with themselves or with their bed partners, and we hear a common story in that the bed partner has to either sleep in another room.
Yes.
And, things like this can cause divorce.
I got so tired of sleeping in my car every night, Dr. Leslie. It was just horrible.
Even with the CPAP machine, you sleep in your car.
Yeah, now they prescribed to me the CPAP machine, which I've worn now for 6 years. I use the nasal, doesn't have the mask, but it's a little uncomfortable. Uncomfortable.
Sure.
How do you treat sleep apnea?
Well, I think it's important for patients or potential patients to understand what the treatment options are. There are always non-surgical options. There are always surgical options. We always try the non-surgical options first and then move on if patients can't. Either they don't...
What would make the determination whether somebody should have surgery or not?
Well, as Steve had mentioned, the gold standard for treating obstructive apnea is nasal CPAP. And for those of you who don't know, CPAP, CPAP, stands for continuous positive airway pressure. If you remember, the airway is soft tissue, it's dynamic, it's always moving. And due to the sleep apnea, the airway collapses, just like a balloon that you let the air out. CPAP will blow up that balloon. It will expand the airway with positive pressure. And for the time that the patient is using CPAP, their CPAP is basically cured. But once that CPAP is stopped, the cure is over.
Right.
And I use the term cure very loosely because other than a surgical opening in the airway, which is called a tracheostomy, there is no cure for sleep apnea. But CPAP does its job. But as you said...
But that's in the evening when you're sleeping.
Well...
So how does sleep apnea affect your daily life?
Well, it affects your quality of life in that if you are
Always tired.
Yes.
right, even if you're using CPAP at night, you're still going to have return to symptoms during the day. And the biggest problem,
So it doesn't get rid of your symptoms throughout the day.
Not a cure.
it's not a cure. And
Right.
the other thing is that people don't realize, and sometimes physicians will not tell you, is that there's a very significant non-compliance rate in using CPAP. For example, if we look at studies long-term as to how often patients will use CPAP, let's say over a 5-year period, the overall compliance rate over 5 years is less than 50%, meaning that after 5 years, less than 50% of patients are still using their CPAP on a regular basis. And we consider a regular basis at least 4 hours a night for 3 out of 7 nights.
And why is that? Why do you think that happens?
Do you like your CPAP?
Well,
No,
I
but he
hate
wears it all
but
the time.
I'd rather wear it than
But
Right.
and he travels with it too.
Right. I mean, some patients will love it and they can't go anywhere with it, but some patients will get tired of it. If there's significant nasal obstruction, they may have problems breathing through their nose. From the physiology of the CPAP itself, it can cause a dry nose, difficulty breathing, a number of symptoms why people just don't want to deal with it anymore. So if somebody, either they don't want to deal with CPAP or for some reason they can't, then we consider surgery. There is another non-surgical option that we do recommend, and that's
Which
an
is what?
oral appliance.
I was going to ask you about that. So what do you think about the oral appliance?
I think the oral appliance definitely has a place in treating both snoring and sleep apnea. But again, patients need to understand, number one, it's not a cure. It will treat the problem, but it is not a cure. The one thing that many people have a misconception about is that an oral appliance is not for every situation. For example, there are probably 100 different oral appliances on the market for treating snoring and sleep apnea. As the airway gets more and more blocked, when the airway has more and more areas of obstruction and the severity of the disease increases, the success of wearing an oral appliance will decrease.
Really?
Wow.
Okay, that's interesting.
Appliances are good for people who snore. They're good for patients who have mild apnea up to moderate apnea. But once you go past that moderate apnea point, an appliance is really not going to do the trick.
I'm going to have to say this, and I hope I don't upset anybody, but, there's the tape that goes across the nose. If you look online, there's these little $10, $12 gadgets. Think about it, okay? I'm telling you, I tried them all. They do not work. And if you've got sleep apnea, don't even waste your money. I mean, it's just a waste of money. It's all it is.
One thing that I will say, I actually came back about a month ago from a national meeting in Charleston where all the major players in sleep apnea treatment were there. And we went over all these different surgical modalities as well as non-surgical modalities. In the nasal cavity or in the anatomy, there are 3 basic structures that we look at to treat. The most common is the nasal septum, which is what most people know about, which is the middle part of the nose. The second are the turbinates, which are the tissues in the nose that filter the air. They moisturize the air. They tend to get very swollen. The area that most people don't realize that can cause nasal obstruction are the nasal valves. The nasal valves are pieces of cartilage on either side of the nose itself. And as we breathe in very forcefully, that inspiratory effort can cause those valves to collapse. And in patients with sleep apnea, they're forcefully trying to breathe in so much, those tissues will collapse. The advantage of using the Breathe Right strip, it will basically take those nasal valves and open them up.
Oh, it does.
So
maybe
So
you
they
just
do
was-
have a place.
Okay, maybe you just weren't a candidate for that.
Right.
Well, the thing is this. If somebody is snoring, the more common areas of blockage in a patient that snores is either in the oral palatal region or the nasal region. If somebody has obstructive apnea, their nasal obstruction is a minor component of the blockage. For somebody that has obstructive sleep apnea syndrome, the majority of their blockage starts in their oral airway and it extends down to their vocal cords. And that's the key to treatment, is analyzing and evaluating where specifically that blockage is, and then designing treatment options that'll address that.
Right, so maybe the strip helps a selected few.
Correct.
So there's different treatments for sleep apnea versus snoring.
Correct.
So some of these over-the-counter do work then, what you're saying?
There are benefits to a number of different over-the-counter solutions. I'm not here to plug or put down anything, but I can tell you from what my experience has been, the Breathe Right strips definitely have a place.
What do you like the best? What do you recommend?
As my old partner used to say, Dr. Sultan, you're a surgeon.
Okay.
But again, I'm going to refer back to the hammer and nail philosophy. We don't treat every patient the same way. If we have two different people coming in with the same symptoms, the same results on their sleep study, the same anatomy, we may design different treatment protocols for each patient based on what their desires are and how we think that they're going to respond.
So this could be surgically corrected.
Again, surgery is not a cure. Okay,
surgery is not a cure either.
So wait a second. So let me just ask you something. So if you have surgery, is that a temporary fix? Is it a long-term fix?
Let me backtrack a little bit.
Okay.
Common question is, does surgery work? The surgery work. If something works, that's kind of a nebulous term. You have to define what your criteria for success is. When you go for a sleep study or you're diagnosed with sleep apnea, you are graded on the severity of your apnea by two different scales. One is called the Respiratory Disturbance Index, or RDI. The other is called the Apnea-Hypopnea Index, which is AHI. Okay, for example, somebody that has a moderate amount of sleep apnea is going to have one of those two scales in the mid-20s. Okay, the basic criteria of success that most surgeons use is being able to either reduce those numbers close to 10 or reduce it by 50%. Obviously, if the criteria is higher, the success rates may be lower. So again, it depends what the criteria is. But it's very important to state, and again, I never promise anything to a patient. I will say we can treat your problems, we can make you better, but these are the statistics that we have, and these are the criteria we use. We never promise success.
Okay, so tell everybody where you're located also. So if somebody wants to make an appointment with you
Sure.
for a consultation.
My main office is in East Fort Lauderdale on Federal Highway south of Commercial Boulevard. We're actually right across from the Holy Cross Hospital main campus. Our surgical procedures are performed at Broward Health Medical Center, Imperial Point, Holy Cross, and a couple of outpatient facilities in Broward County.
Okay, give your phone number once again before we go off the air.
Sure, 954-771-8772.
And your website address.
www.sultansurgicalcenter.com.
And Dr. Sultan's going to be with us every month. And if you've got a question, go ahead and write it down. We'll be
Or
back.
just call him directly.
Call him directly. And did you see how fast this went by?
Yes.
And we're not going off the air, Schmageg. We're not. We got another half hour to do.
We do.
Anyway, thank you so much for coming on today.
Thanks,
oh, my
Dr.
God,
Sultan.
I love doing this show.
You're very welcome.
Maybe we'll save a marriage doing this, huh?
Maybe.
Never know.
Thanks so much. We're going to go to break right now. We will be right back.
Thank you.
Secure Restoration Services is proud to be chosen the expert for the Ask the Expert show in the areas of water damage restoration,